in the recent past. With the the original SARS-CoV-1 that was here in 2002 sort of prepared us in as far as realizing of this type of virus, which has been a combination of both animal and human species. The work that was done on SARS-CoV originally prepared us for the second installment of this, which was in 2000, I believe it was 2009, 2010, and through there. And that would be the MERS, the Middle East Respiratory Distress Syndrome. Vaccines, actually, the work for the vaccines, contrary to popular opinion, actually began back then with those coronaviruses. However, because those coronaviruses didn't evolve into a full pandemic, work sort of stalled on those. But the original groundwork, the original architecture was made for those types of vaccines, so that when SARS-CoV-2 came on the scene, we were somewhat prepared. Talking specifically about the mRNA vaccines. Again, those weren't just thought of, or those weren't just exactly invented overnight, if you will. So there has been a basis for those. But again, to mention the fact that this pandemic has really propelled us in as far as our knowledge and as far as our techniques and tactics, as far as dealing with the virus, that is identification, and then coming up with possible treatments for it. Still a learning process. We've come a long way in the past year. The vaccines, however, are appearing to make a bigger difference. But still, as Connie mentioned, we aren't there yet. To put it in football analogy, we're heading toward the goal line, but we're not there yet. So we can't spike the football just yet. So we all need to double down on our public health measures, public health mitigating measures, masking, washing hands, social distancing, avoiding crowds, and also add to that now with the vaccines. If we do this, we can get through this period. We can get through this pandemic and be successful, get it behind us, and get back to a semblance of a normal life. Thank you very much.
Thank you, Ms. Mendel and Dr. Burns, for those informative remarks. And now we're going to begin with our listener questions. And one of the first questions that we've got is, when and where should I go to get the COVID-19 vaccine? And is there, and this is kind of an aside or attachment to it, is there any place where you can drop in and get a vaccine without having to have an appointment?
So,
Connie?
great question. Yes. So, yeah, absolutely great questions. As I briefly mentioned, there are multiple places available with appointments as early as Friday. Like I said, and thank you, Scott, for posting our webpage. That's a great place. Those are listed. Like I said, when I looked up, there were some Friday and Saturday, and even through the first of the week. Most places still want you to make an appointment ahead of time, and a lot of that is helping us to manage the vaccine. The vaccine is such a critical resource, and there are so many doses per vial depending on the manufacturer, and we want to use each dose. So we're trying to schedule exactly enough appointments to match the doses in the vials. Once we pierce that vial, most of them have to be thrown away within 6 hours. So we don't want to, we have a zero waste policy. So that scheduling, so a lot of times we'll schedule in groups of 6 or groups of 10, depending on which vaccine is being used. Although I will say it's my understanding that the newest location in Shawnee is available for walk-ups, and that is at Young Elementary School, and that information is available on our site. I also want to say that you can call, and I can put that number in the chat, but 502-912-8598 for someone that may have some concerns, or if you're like my mom had some tech issues, as far as she doesn't want to email and she doesn't want to social media. And so please call that number and they can help you schedule an appointment.
Great. Okay. Our next question is, what score or amount of antibodies provides protection against COVID-19? How long does the vaccine last in us, or at what point is there significant decay or reduction in vaccine protection?
Okay, well, thanks for the question. I can address that. The vaccines themselves, a lot of this, again, we're still learning and it's relatively new. It was mentioned most recently that there have been studies done with antibodies that are formed what we call naturally, and then antibodies formed through the vaccines. With regards to the vaccines, so far, it's been shown that the antibodies are lasting, they gave a specific number, 209 days. And that's projected right now. And in truth, it's probably longer than that. But based on a couple of recent studies that were done, those were the numbers that they came out to be. But again, this is something that's still in progress. It's still being watched. But the key point here is that being vaccinated, you're going to have antibodies that are going to last longer than, let's say, for example, somebody who has had COVID-19. The antibodies that they generate naturally will last. They were projecting up to about 3 months. But again, it's been shown that the antibodies that are formed through vaccination are going to last much longer than that. So now I can't really tell you a specific level, if you will, but I can say this. The manufacturers of the vaccines did talk about, when you look at Moderna and when you look at the Pfizer ones, initially, they were 94.5% and 95% effective. They, again, didn't give specific numbers, but saying that they were efficient and effective to those levels, which, by the way, are legendary. We've never had vaccines to affect or to cause effectiveness to that specific level. Even our flu vaccines, with our best efforts, may be 60% effective. So again, this is somewhat legendary. So anyway, I can't give you specific numbers for the antibodies per se, but suffice it to say, the antibodies obtained through vaccination last much, much longer, and it's still an ongoing study.
Okay. Well,
and if I can add to what Dr. Burns mentioned, that's why it's so critical to get the second dose. If you're using a 2-dose vaccine, if you've got either Moderna or the Pfizer, we've had a lot of people not show up for their second doses. And I think some of it is fear. They're hearing of the side effects of the second dose, but really to help fight those COVID variants and get the longevity out of the vaccine, it is really important to get your second dose.
Okay.
Yes, and those quote unquote side effects, that's really your own immune system working, showing that your immune system is functioning at a very high level. So technically, and I realize people call them side effects, and everybody does. But unfortunately, or should I say truthfully, they're not side effects. It's really your body working. That's your immune system working, and those are good signs and symptoms to have.
Okay. Well, we had another question that kind of trails off of the one you just answered. And is there a test that one can take to determine the efficacy of the vaccine?
No, there's no real test that can be done. Again, the manufacturers have done all the testing, and the efficacy rates are a reflection of those tests. So again, as Connie mentioned, you want to make sure if you're taking the any of the 2-dose vaccines, that you get your second dose to get up to that 94.5 and 95% efficacy. If you only have 1 dose, yes, you will have some degree of protection, some degree, but it won't be nearly. It won't be what the manufacturer says when they talk about 94.5% and 95% efficacy.
Okay. Well, we've got a question now from someone who says, if a person has had COVID and they received the vaccine, is the reaction to the vaccine more severe?
Not necessarily, because see, and some of them may have to do with timing a little bit, but if they've had COVID, they're going to have antibodies. But as I sort of mentioned before, those antibodies that they generate for that COVID that they got exposed to, they will last, but they usually don't last a very long period of time. The interesting thing, and I guess we'll be getting into this in a little while, is that we now have the presence of variants. Now, if this person had COVID, let's say early on, then they were most likely exposed to what we term as the wild type version of COVID-19, which is different from the variants that are out there. And I'll just briefly mention for talking point, the 3 major variants that are predominant here in the U.S. The 3 major ones are the B117, that's originally from the UK. We have the B1351 from South Africa, and then the P1 from Brazil. And it appears that the B117 had been projected and now appears to be the most predominant type of the COVID viruses that are here in the US. It is much more contagious, and we are finding that it is much more deadly. Initially, when it came over, we said that we would study that. If you listen to what Dr. Fauci said, that it was going to be studied more, but it actually is turning out that it's resulting in more hospitalizations, which ultimately can result in more morbidity and mortality.
Okay. Well, we've got another question that's come across. Is there any data or research to support why some people have mild side effects versus more severe side effects after having the vaccine? Does a previous case of COVID-19 have any effect? And I think you just answered that part of the question, but is there any research that explains at this point why people have different reactions?
No, to my knowledge, there isn't necessarily anything that does that. Again, when you have the reaction, if you will, to your COVID shot, when you talk about the things like the muscle aches, the fevers, the weakness, the decrease in energy, again, that's as a result of your own immune system revving up, and your own immune system reacting to the vaccine. And again, that's actually a good sign. That shows that your immune system is working, it is functioning properly, and is reacting to this foreign material from the vaccine. It's actually known as an antigen, and it's supposed to stimulate antibody production, which it's actually doing. So again, it's a good sign. It definitely is a good sign.
Great. That's a great answer. Thank you very much. The next question we've got, it's a little bit unusual. This person got their vaccine at a store, one of our grocery stores in Lebanon, Kentucky on March 11th. And they want to know, could they get the second vaccine in Louisville? The reason, of course, they did it in Lebanon was they couldn't get an appointment in Louisville. So, but once eligibility has opened up here, could they get the vaccine, the second one here? Is that possible?
They can. I will say, and at one point, they could not. Everyone needed to return to the first place. That policy has changed. I will say, it's best if people do get it at the first, because the provider that administered the vaccine is receiving that boost dose. So automatically, if we vaccinated 1,700 people yesterday at Broadbent Arena, we will receive 1,700 second dose of Pfizer to match. But we also understand that people miss appointments or they've traveled to get appointments. So it is possible to get your boost dose or your second dose at another provider.
Okay. Well, this question kind of goes along with that one, where this person wants to know if they couldn't get their second dose because they were hospitalized, should they reschedule with the original provider or ask the hospital to try to give them the second dose?
I would say certainly if they're currently hospitalized, if that healthcare provider is able to do that, it's worth a request. But they should also be able to reschedule their second dose with the original provider. It still just goes back, with vaccine inventory and management, as you can imagine, it's been a huge undertaking. It's something that I've never, and Dr. Burns can comment on, but it's something that is, unheard of when you look at the amount of vaccine that's been administered in such a short time. So anything that we can help with inventory and matching doses and making sure that we have enough for everyone, it's just, if everybody could go back to the first provider, would be hugely helpful.
Yes, I agree. That makes it logistically easier. And then if you have to stray outside that, as long as you're getting, the next best situation is you want to make sure you're getting the same vaccine, and you want to make sure, try to have it on schedule. If, let's say, something does happen for whatever reason, either Moderna or the Pfizer, in order to continue with the very high efficacy that I've mentioned before, you want to try to get it within a 6-week period of time, if at all possible. And worst case scenario and last ditch effort, and there's no other alternative, then you can use a different vaccine if for whatever reason it's not available. I mean, but that would have to be the absolute, positively final alternative, that there's no other way to get it. And for whatever reason, let's say you got Moderna the first shot, but for whatever reason, there's no way in the world to get Moderna, then yes, then you can have the other vaccine. But we definitely do not like to do that. That would have to be the absolute worst case scenario and have to be the ultimate final alternative.
Okay.
And, and Dr. Burns made a great point. If you want to get the same vaccine and you want to have your vaccine card with you, here's mine. You should have received that. So take your vaccine card with you to get the second dose. Eventually, all of those doses administered will be in the Kentucky Immunization Registry. But as you can imagine, getting all of that information entered in a timely manner, given the thousands of doses that are being administered a week, it's just really important to have that card and keep it. I've laminated mine, so also maybe a good recommendation. But yeah, definitely check out. You can use that phone number again, that 912-8598, if you need some help locating a provider that has that specific vaccine manufacturer.
All right. Thank you, Connie, and thank you, Dr. Burns. We have another question now. And this one is from someone on behalf of her daughter. Their daughter is trying to get pregnant, which is causing her not to want to get vaccinated. Can we address her concerns?
Okay, yes, that's a great question. First of all, I would always recommend that for pregnant women that they talk with their obstetrician. Now, one other thing that you should know, pregnant women are at higher risk for COVID versus a person who is unpregnant. Okay, so we still strongly recommend COVID vaccination for them. Studies are ongoing, but so far it has not shown any deleterious effects, and it's actually recommended that pregnant women do take the COVID vaccine. And the COVID vaccine is not only good for them, but it actually does cross the placenta, and it will give antibodies to the baby, to the unborn baby as well too. So again, pregnant women are at higher risk, and it is recommended that they get the COVID vaccine. But of course, always talk with your obstetrician first.
Okay. Our next question is, what can you tell us about the differences between the vaccines that are currently available? Is there some reason for people to try to hold out for Pfizer, Moderna, Johnson & Johnson? Is there some reason to choose?
Yeah, I can answer that too as well. The best vaccine for you to take is the one that's available for you. Okay, that's the one. So the picking and choosing, it's really they all have very high efficacy. They're all safe and effective. We recommend getting the vaccine that's offered to you. That's the one you take. Now, there are differences in the vaccines. The first two that I've been mentioning, the Pfizer and Moderna, they are what we call messenger RNA vaccines. And I'll just make it real simple. It's something that you, these two vaccines, when you inject it in a person, it codes for your RNA to make proteins that are similar to the spike proteins on the virus. Okay, so your body responds to that. The Johnson & Johnson vaccine is a little bit different. It actually is onto what we call an attenuated or a very weakened adenovirus. It's from a monkey basically, and it is actually the proteins are attached on to that virus, such that when it comes into your body, the virus gets destroyed. And the virus is no problem. It's weakened and has no kind of defense at all. And then your body sort of reacts to those proteins by making antibodies to those soluble proteins that are attached on to that particular virus. So again, those are probably the differences. The other more important thing, the other important thing too is that the first two that I mentioned, the Moderna and the Pfizer, those are two-shot vaccines. The Pfizer, there's a 21-day period between shots. The Moderna, there's a 28-day period. The Johnson & Johnson vaccine is a one-shot vaccine. Once you get it, that's it. Now there are advantages to that depending upon who's being vaccinated. Those people who are, for lack of a better term, not really very compliant in keeping appointments, it's probably better if they receive, if possible, they can receive the Johnson & Johnson vaccine, because once they get it, that's the only injection they need, versus the two-shot vaccines, the previous ones I've mentioned, the Pfizer and the Mendel.
Okay. Well, I think Dr. Burns, you mentioned this a while ago in a comment, but the question is there an expiration date on that second dose? If a person was scheduled to do that second dose on, say, April 5th, but they're somewhere still in the hospital, not available to get to that dose, Pfizer, April 5th was the 21st day. How far can they go out before?
Sure. Of course, we like to stick with the manufacturer's recommendations. So that's the best situation. But as you're alluding to, sometimes things may happen. We try to say to still get that same effectiveness, that same degree of efficacy. We'd like to have them done within at least a 6-week period of time. So in other words, for the Pfizer one, up to 3 weeks, and for the Moderna, up to 2 weeks beyond what their original date of vaccination should be. Worst case scenario, you know, if you can't get in or can't get it within that period of time, just as long as you get the second dose. Now, it may not be 94.5 or 95% effective, but it will still be effective. So as long as you can get it whenever you can, you know, beyond the 6 week window.
Okay, great. Well, we had 100% of our people answer the poll saying that they had had at least one dose of the vaccine. So what does getting vaccinated actually mean for us? We've mentioned social distancing, wearing masks, not being able to gather. Those are burdens that a lot of people feel like they've been carrying for a whole year. When do we think we can return to normal levels of connection with family and friends?
And I'll begin and let Dr. Burns add, as he always does. So one, the most important thing you get with vaccination is preventing serious disease, serious outcomes, hospitalization. So, you know, obviously that's the critical piece to be vaccinated. But the CDC has released new interim guidelines if you are fully vaccinated, and that is, it's been 2 weeks since your second dose, if you've taken a 2-dose regimen of the Pfizer and the Moderna, or 2 weeks post your one and only shot of the Janssen vaccine, you're considered fully vaccinated. And with that, it means that you can get together with other fully vaccinated people indoors and safely unmasked. So yay, that is exciting. And you know, even if you can, according to the CDC, it's safe to work with people that are not, if they're not at high risk, in a single family or single household. You can also congregate with them unmasked. You no longer are required, or you know, don't have to worry about self-isolating after travel or testing after travel. So those are great things. You're not worried about the quarantine. But if even if you are fully vaccinated, you're going to be in large crowds indoors. It's still recommended that you mask up. If you're going to be with people who are at high risk for COVID that have not been vaccinated, also, you know, mask then. And then still avoid any medium or large size indoor gatherings. So, and I'll let Dr. Burns add on.
Okay, yeah, not really much more to add to that. Hopefully, becoming vaccinated will help be an incentive to begin to do things more normally. Again, I think that the key, as Connie was emphasizing, that if you're in a private situation with single family household, that everybody's been vaccinated, or people who are at low risk for a bad outcome if they were to get COVID. As long as you're in that type of situation, then yeah, absolutely, it's okay to unmask. But any type of public situation, any type of public gathering, you still want to wear a mask. And remember, you're masking, even though you're fully vaccinated, you're masking to protect other people. Reason being is, and I'm sure this question will probably come up too, is that we're not 100% sure exactly, as far as transmission goes, if a person who is fully vaccinated, if they can transmit the virus or not. That's still being worked out. There have been a couple studies that have been done that have shown that people who are fully vaccinated, some studies have shown that they don't carry the virus. Other studies show that they do maybe carry some small degree of virus, small degree with them. And the question is, you know, when it comes to transmittability, that's still being worked out. But again, going back to people who are fully vaccinated, that's why they still wear masks, especially in public, they wear masks. So some of that stuff is still ongoing, but the key is, if you're in public, wear a mask and continue your public health mitigating measures.
Okay, thank you very much. I know, Dr. Burns, you've talked quite a bit now, but I want we've got one more question that I think is going to be for you. And this is something related to the kinds of rumors that we hear and read out on Facebook and Instagram and whatever. And the question is there any proof that the vaccines cause mental confusion and lack of mental concentration? And if so, what can be done to improve this condition?
Okay, well, first, let me say, whenever you're wondering about the vaccines, make sure you turn to a reputable source. So always, I would say, first and foremost, check the CDC website. There is plenty of information, plenty of good information, and information that we use as clinicians and people refer to if they have questions or problems when it comes to interpretation of things with regards to COVID-19. Secondly, getting back to your question, Ms. Turner, it almost sounds like that's somebody who's had COVID, to be honest, quite honest with you. So, but as far as the vaccines causing that, there's been no proof of vaccines causing anything like that at all. And then other, again, rumors like, well, does the COVID-19 vaccine give you COVID? You know, the answer obviously is no. I've heard many different rumors, anything from it's really, you know, when you get the vaccine, putting transistors in you, you know, and things in your body, and things doesn't affect your DNA and all these types of things. No, these are all rumors, unscientific, not proven. So again, I would say, you know, in anything you hear, anything a person quote unquote hears, I would say check it against a reputable source, and I would recommend the CDC website.
Okay. Well, thank you, Dr. Burns. And there are several places that are listed now in the chat. Phone numbers for, the CDC is absolutely a great place. But if you want to contact the Louisville Vaccine Helpline, that is at area code 502-912-8598. We also have the Louisville Government COVID-19 Resource Center, and that can be reached online. And that's there's a Louisville Government Louisville COVID-19 Resource Center. It's in there twice. Thank you. And then, of course, there is also AARP.org/COVID. And there is information there as well. Okay, we have, of course, more questions. We can't be through yet. Any additional guidance for fully vaccinated individuals? Because we did talk about what fully vaccinated means in terms of 2 weeks. And we've said we can still possibly be carriers of the vaccine. Is there any other guidance out there at this point?
Just what's at the CDC. They did make mention recently about travel guidance. They said that basically, if you've been fully vaccinated, now within the U.S., you don't need to have any COVID tests done. You don't have to do anything at the airport or show anything at when you're boarding or departing. When you're doing international travel, you pretty much have to abide by whatever country you're going to, whatever guidelines they have. That's sort of the basic bottom line to the travel guidelines. And I believe as time goes on and as more people get vaccinated, Dr. Walensky of the CDC and Dr. Fauci, they just so you know, they have COVID updates every Monday, Wednesday, and Friday online at the it's one of the whitehouse.gov websites. You can just Google something like that and find it. It's usually every Monday, Wednesday, and Friday, usually around between 10 and noon usually. But again, as time goes on, they'll be giving more guidance on those types of things.
Okay. Another question, is anything being planned to vaccinate homebound people yet? Is there anything going on in Jefferson County for them?
We do have not only plans in the work, but have begun doing homebound vaccinations. So, and this is a partnership through our vaccine task force. So University of Louisville, Norton Baptist, and some of the pharmacies in town are all members of our vaccine task force. So you can use that number again, the vaccine helpline number, if you have someone that is homebound and would need someone to come to their door. It is one we were working a lot with. The Janssen vaccine was our plan because that is a one-dose vaccine, and a lot of resources go in, as you can imagine, to do a homebound trip. You know, with all the vaccinations, there's a 15 to 30 minute observation period after administration of the dose. So just the logistics of having a medical provider, you know, go to someone's home, and we still battle the vaccines, their storage requirements, and using that vial, like I mentioned earlier, within that 6-hour period. So there's a lot of moving pieces to do that, but we have begun that, and that is available to the community.
Okay. Well, Connie, we have another question that's related to that, and they weren't sure if this maybe was the best place to ask the question, but if folks need a ride in Jefferson County to the vaccine appointment, what should they do?
That is one. If someone is already registered for TARC-3, TARC-3 is available for them to schedule an appointment to any site, any doctor's office or other. And we are, again, working transportation, providing vouchers or other sources. So that is a plan that's in the work. It's not finalized, but we should have that soon. So that helpline will help with that also.
Okay, great. Now, Dr. Burns, we've got another question for you. You're so popular. With the new variants that are going around and children are now returning to school, do you see a fourth surge coming, especially considering the children 15 and younger are ineligible for the vaccine? Any idea when children will be eligible?
Well, to answer your second question, there are ongoing studies right now. So far, they've shown a lot of safety and efficacy in, I believe, 12 to 16-year-olds. So, and the way they tested, they do sort of a breakdown of like ages. I think next will be 9 to 12, and then 6 to 9, and things like that. And suffice it to say, by the fall, we should have official CDC recommendations about vaccinating children. In regards to your first question, it's kind of interesting. If you look at the graph of number of cases, and if my memory serves me correctly, I believe nationwide there were around 65,000 new cases on an averaging on a daily basis. If you look at that graph over the last 4 weeks or so, well, let's see. Let me say this. Initially in March, the number of cases were coming down. We were coming off that third spike, but cases actually started leveling out. And here recently, as I mentioned about the 65,000 cases per day, it's actually starting to sort of uptrend just a little bit. They've certainly leveled out, and usually before a spike, we see a leveling of cases prior to that. In addition, you take into consideration, this is spring break season, and I'm sure you've seen those pictures of the people down in Florida and places like that, congregating, not socially distancing, not very, very few wearing masks. It sort of makes us poised for another spike. So I don't think it would be the children go back to school that would make a spike more so than our public situations with regards to something like spring break. With that in mind, now it doesn't necessarily mean we have to have a spike, because there's still time. And I always mention, you know, if we can all double down on our public health measures and we get vaccinated, we can avoid this potential spike, because we are poised for one. But it doesn't have to be that way. We can avoid it. In addition, the variants aren't making things any easier either, especially with that B.1.1.7. Again, that's predominant. Again, also much more contagious than the original wild type coronavirus. And then finally, another thing that's not helping matters either are some of the states are opening up and dropping mass restrictions and things like that. They're increasing capacity. That's not helping the situation either. It's almost like we're fighting against ourselves, basically. That's the way it kind of appears. So all these types of things could potentially lead to a fourth spike, potentially. But again, we're not spiking. We're not there yet. We don't have a large spike yet. Again, public health measures, vaccinations, being diligent. Okay, we can avoid a fourth spike.
All right. Well, that's encouraging. So I want to remind people again, the Louisville Vaccine Helpline is area code 502-912-8598. And you can get lots of different information there. But one question we still have from people is, what percentage of people in Louisville, Jefferson County have been vaccinated? Connie?
Sure. So for those that received their first dose, we've vaccinated over 281,000. So that's about 37% of our population. And for those that have received both doses, we're at about 20%. Now, we have given, through the healthcare partners, the health department, family health centers, and those type facilities, many more doses than that. But if you remember the original rollout, we were working with vaccinating those most likely to be exposed, our healthcare workers. So the healthcare workers in Jefferson County live beyond our county borders, as you can imagine, even the state borders, and again with educators. So, we've given a lot more shots than that, but when you look at just Jefferson County residents specific, we're about 20% that have had both doses.
Ms. Turner, one thing I wanted to mention as well too, when we were talking about the potential spikes, just so you know, it appears now that the age group that's getting affected more, not necessarily our senior population, because the vast majority of them are vaccinated, but now it's the 30 and 40-year-olds. Those seem to be making up the majority of new cases that we're seeing. So again, this all goes back to getting vaccinated. I believe that, Connie, correct me if I'm wrong, but I think it's now open to everyone above age 16. And so everybody can, it's a free for all. Now everybody can get a vaccine. So it's available. So everybody should get vaccinated. It's your turn, everybody. Right. So so by doing that, again, especially these 30 to 40-year-olds, in that age group, that's what's spiking the most, or that's who's spiking the most now.
Okay.
And there are plenty of appointments available.
Okay. Well, we're about at the end of this conversation. And before we close, I know it sounded like you guys were giving us closing remarks, but I'm sure that you've still got one more thing you'd like us to take away from the conversation. Dr. Burns?
Yes, just again, it kind of goes back to what I said a little bit earlier. We're so close. Dr. Fauci will tell you that we haven't turned the corner, but we're at the corner, and I would agree with that 100%. It's still things can go off the rails, but I have confidence, I have faith, and I believe. Again, especially now with the vaccines being available to everyone, if everyone gets vaccinated and everyone continues to double down on the public health mitigating measures, and let's not open too soon, but let's be diligent. Let's continue to be positive. Let's think more of the other person than ourselves. And then let's do what we need to do to protect others, and we can get through this. And the hopes of a 4th of July being somewhat normal is reality, is a reality. But we have to bear it down. If you're running a marathon, you're not going to stop at the 23rd mile. You have to keep pushing through to the very end, to that 26th mile. And that's what we all need to do.
All right, thank you. Ms. Mendel?
Sure. Well said, Dr. Burns. Thank you. And what I will add is that for those of you who have been vaccinated, thank you very much. Please encourage your friends, family members, colleagues to be vaccinated. That is our goal, to have everyone vaccinated. So please do that. There are plenty of appointments, for example, at the mass vaccination site opening at Cardinal Stadium. And we also have volunteer opportunities available if you want to help us vaccinate folks. So those at our broadband location, and as we do community events and pop-ups, like we talked about homebound. So, you know, it's this time of year that our mayor promotes Give a Day, and, you know, absolutely. So all of that, reach out to us, and you can help us vaccinate your community so we can be safe quickly.
Great. Well, I want to thank both of you, Dr. Burns, Ms. Mendel. It's just been a pleasure being here, listening to you today and learning from you. But I will have one final piece of information for our listeners. We want them to be aware of COVID scams. Scammers are going to try to offer quicker access to vaccines for a fee, claim to sell in-demand supplies like face masks and test kits, and then hack social media accounts or send text messages saying you've been exposed and need to click a link for more information. We're asking people, please engage your inner skeptic when you see ads and special offers making these claims. Real contact tracers will not send you a link to click or ask for money or sensitive personal information. If you have questions, call the AARP Fraud Watch Network helpline at 877-908-3360. Okay? So on behalf of AARP Kentucky, I want to say thank you all for taking part in today's session on COVID-19 vaccines. Special thanks to our guests, Ms. Connie Mendel, Dr. Mark Burns. We hope everyone found the session informative and engaging, and we thank you for participating and asking such great questions. We know so much more now, and we can look forward positively. So have a wonderful day. Thank you all.